On today's Clinical Excellence podcast, we have Dr. Wei Li talking about physician burnout.
The average is around, between 45 and 50% when you look on average,
grim.
right? 1 in 2 are experiencing burnout.
We're back with another episode of the Clinical Excellence podcast sponsored by the Bucksbaum Institute. During this podcast, we discuss, dissect, and promote clinical excellence. We review research pertinent to clinical excellence. We invite experts to discuss topics that often challenge the physician-patient relationship. And we host conversations with patients and doctors. I'm Adam Sifu, and I'm joined today by Dr. Wei Li. Dr. Li is a general internist and associate professor of medicine. Her academic research focuses on developing innovative patient-centered models of care and improving patient-physician communication. She is the Associate Dean of Students and Professional Development and Director of Wellness Programs at the Pritzker School of Medicine. She's a senior faculty scholar at the Bucksbaum Institute for Clinical Excellence and a fellow of the Academy of Distinguished Medical Educators. Whew! Thank you for joining us, Dr. Li.
Dr. Sifu, it's a pleasure to be with you today.
It was kind of exhausting going through all that stuff. I'm almost burnt out.
Good thing we're talking.
Anyway, so I've asked you here so I can ask you a couple of questions about physician burnout, which I think you have spent an enormous time not only sort of researching and thinking about, but actually like acting on and trying to figure out ways to, make life better for physicians. And I'm kind of a doctor who hates to talk about burnout, so I was really looking forward to talking to you. So can you just start us off with kind of definitions, like what is burnout? How do we define burnout?
Yeah, no, that's a really good place to start. And I think burnout is certainly a condition and something that we've talked about in the medical profession more and more over the past 15 or 20 years. The formal definition is typically related to the Maslow burnout inventory. So this is one of the key tools that's used to assess burnout, not just in medicine, but across many different professions. And it has 3 elements to it. So burnout is typically defined as emotional exhaustion. So feeling completely bone exhausted, really, really tired emotionally from the work that you're doing, in the workplace, for us, medicine. But then depersonalization is also a big part of it. And so that is feeling distance from your patients, compassion fatigue, seeing your patients more as objects than the human beings that they are. And lastly, just a very low sense of personal accomplishment or loss in meaning in the work that you do and feeling that your own personal efficacy is at a quite a low place. And importantly, the idea of burnout is that it's actually a workplace-related syndrome. So related to a lot of chronic stress at work that is not related to personal resilience, an individual's ability to be able to manage stress. Because as physicians going through medical school and residency, and for us in academic medicine, I think all of us have incredibly high levels of resilience. And when you take a look at studies around resilience, physicians often have higher resilience than peers in other professions, and even physicians who score the highest in the ratings for resilience experience burnout. Okay. So those are kind of the things to think about.
So I think maybe as you said that, I had a question, and I think maybe you answered it. But my question is some degree of burnout normal and unavoidable? I sort of think about, I came back from vacation a week ago, and my first afternoon in clinic, I was so struck by how good I was. I was incredibly relaxed. I really listened to people. Nothing bothered me. And I was like, boy, a week ago, I was not like this, right? And I wouldn't back then have considered myself burnt out, especially given the things that you just talked about with kind of depersonalization and all. But I don't know, is it sort of a spectrum of boy, there's just regular work fatigue and angst, and then burnout is beyond that? Or how do you think about that?
I do think that it is a spectrum. I think that, we're not going to experience our work lives and our lives in preparing to be physicians in medical school and residency without high levels of stress, high periods of really needing to be productive and whatever that means, whether it's research or really thinking about, your standardized exams at that point in your life. Or there are always high periods of stress in your life and career, right? But burnout is beyond that. It's sort of that chronic feeling of being completely depleted for very long periods of time. I do think stress and burnout are part of the lived experience for every physician. But I think there are points at which burnout becomes, impactful on your own quality of life, but also the impact it has on the meaning you're bringing to work, and then on your patients as well.
Sure. So you mentioned, which I loved when you sort of went through your first spiel on this, that it's very much related kind of to the job, right? To the situation. And I feel like there was a time that a lot of the responsibility was put on the physician, like it's your fault that you're burned out, because we could probably design a job that would burn out anybody, right? But so what I was going to ask is about kind of predictors of burnout. And I'm interested, like, are there predictors based on the job, but are there also predictors based on the people, like who's more likely to get burnt out in the same job?
Absolutely. So those are really great questions. So, I mentioned that, the idea and study of burnout and physician well-being is a fairly new field. I would say the past 20 years or so, we've seen a really large, number of publications around burnout. And so what we do find is that there are some factors that can predict burnout. And some of them are just the specialty you choose, right?
Yeah.
So when we look at studies on burnout, the average is around, between 45 and 50% when you look on average, right? 1 in 2 of our colleagues are experiencing burnout, right? But it's also a wide range. It ranges from like 30 to 70% depending on specialty. And so those in sort of the lower burnout realm, so below the mean, are like pediatric subspecialties. People think about ENT, optho, sort of in that realm. Psychiatry is also lower burnout. The ones that are higher are emergency medicine, OB, family medicine, internal medicine, and subspecialties. So there's a whole wide range of burnout within specific fields. And some of that is work related, right? Workplace related. Other things are also more obvious, right? Number of work hours that you are putting in, number of nights and weekend calls, work-life interference, right? So this is an idea that Mark Linzer at Hannepin has done a lot of work around, who's also a general internist. And so how much work are you bringing home, right? Is it the work after, work hours with the EHR, documentation burden, all of that. But then there's also other things related to, EHR, how inefficient it can be, loss of autonomy or control at work. So how much you're able to think about your schedule in a way that really allows you to do the work you need to do, but also manage the things on the life front that are important. And then malpractice, that always has a role to play in burnout.
Like if someone's experiencing a malpractice suit at the time.
Correct.
This is going to be more personal experience, not getting personal with you. You spend a lot of time with trainees at every level, medical students, residents, and I imagine do a lot of kind of career counseling as part of that. Do you sort of, as you talk to an individual and you get a sense of them and what they're like, what they're looking forward to their future, do you sort of consider burnout when you make recommendations about the field people go into? Not that they're going to listen to you really, but...
I do. And I do that because I do think that it's really important to acknowledge. And I think that's what's really happened in medical education, in the past decade or two. My role is an associate dean of students, but part of my role is actually directing the wellness program. And I know when I was in medical school, wellness programs did not exist, right? And right now, residency programs have, committees. A lot of the faculty workforce are thinking about burnout and how to address it within the academic and other settings, right? So infrastructure is there, and that sets us up to really talk about burnout early on because the studies are there. We know that there needs to be something done in our pipeline to address it because we talk about burnout being a work-related syndrome. And for our students, that a lot of that is medical school, managing with the known stressors that we all have to deal with. And so what's nice is that now it is literally built into the talk I give at orientation around well-being. Like this is the data, this is the epidemiology. 40% of our workforce experiences burnout. We have data on, depression and mental health prevalence in medical students and in physicians. We want to really draw attention to these concepts of how to recognize when you yourself are unwell so that you can tap into resources, but also to normalize because so much of our culture in medicine is around power through,
Sure,
keep working hard. That's what we value. Patients come first. And so a lot of that, I think, is something, that we're thinking about really actively. And culture change is hard, And so when I advise students as a career advisor about their specialty choice, about what do they see in their life beyond just their career and professional, what are the things that are most fulfilling for them? We talk about all that in the context of how your personal choices and your professional choices are intimately going to impact each other because, I think having that information and having that, data available is really helpful to them.
One of the things that makes me super proud about being a physician, and I think it's one of the things that brings us, respect in our society and all the privilege that it takes, is that right. A lot of us see this as a vocation. A lot of us see the selflessness that you talked about being really core to the mission. And maybe it's just being an old man. Sometimes when I hear people talking a lot about, self-care, I worry that, boy, does the pendulum go too far? And obviously, look, if you as a doctor feel terrible and are miserable, you're going to do a terrible job taking care of your patients, period. We all understand that. But I guess it's just finding that balance of when are you caring for yourself enough and when are you caring for yourself too much and not caring for your patients enough?
I love that. I think self-care is a really charged word sometimes. I do think that I love that perspective. I mean, so many of us went into medicine because we do want to do something that is incredibly, hopefully helpful for our patients, helpful for society. There is that part of, working hard. That's part of our work ethic, right? But at the same time, I think physicians have a hard time drawing boundaries. There's a lot of maladaptive perfectionism. There's a lot of the sense of I need to do it because no one else will. And there's a lot of lack of self-compassion at times, right? If you make a mistake, we're in a culture where it's really hard to talk to colleagues about mistakes. It's really hard to feel like everyone else around you is incredibly smart, incredibly productive and successful. And so I think that within that culture, it's really challenging to draw boundaries that are healthy. And so if you even take a look at some of, a lot of the data around physician burnout, part of it is, even our internal data here at University of Chicago, when we look at burnout amongst our faculty, one of the major things, especially, during the COVID pandemic, has been just having a hard time turning it off, right? Going home and not being able to fully engage in those things that will help you recharge, not being able to turn off the work or those expectations. And so I think it is a spectrum because that self-care piece, you're not going to yoga your way out of depression or meditate your way out of, massive burnout. We need to address those organizational and systemic drivers of burnout. And again, I don't think it's a self-care piece. That's where the literature is moving these days, right? There's a model that's out of Stanford that looks at burnout. And the major drivers are the culture, of the organization, as well as efficiency of practice, how easy it is to practice in your particular setting, to do your research, your administrative work. And the smallest piece of that pie is that personal resilience and self-care piece. So the self-care piece is not going to get us out of the burnout conundrum. It's really systemic interventions to address kind of the workplace conditions.
Great. That's, I think, really well said, because for me, it's sort of separating, it's making sure the things that I personally see as, I don't want to say magical, but that's a little bit too strong, about physicians. It's about the fact that we are committed to beneficence and grace and things that almost sound spiritual and religious. And I don't want it to sound like practicing in that way is at odds to becoming burnt out, right? And you, I think, do a really nice job of articulating why those are totally different things. Why, you can be that physician which you sort of hope to be without killing yourself.
Yeah, and I think for so many physicians, people do see it as a calling, right? And for many of those wonderful characteristics that you just mentioned, as far as being why you were drawn to the profession, but it is that being able to find meaning in your work, being able to, have those connections with your patients, with your mentees, with the work that you do, making a difference. Like that idea of being able to find that meaning in your work is a large part of protecting against burnout in many ways. And that's what I think some of the other stressors that exist around practicing in medicine from the systems perspective, from the efficiency perspective, that's where it encroaches on.
Okay, let me ask you one more question then, and maybe to sort of put this to use in a way. Actually, I have two questions. My first question is, so when you yourself are feeling like, oh boy, I am pushing the edge here, and I feel myself, patient sits down and starts telling me their problems, and I'm like, God, why does everybody complain to me, What do you do when you start feeling like that? How do you sort of step out and like almost rescue yourself?
Yeah, and it is so tough. We've all been there. I mean, I've been so burnt out at many points of my career and life, whether it's life stressors or work stressors. I think the first part is acknowledging it, right? Yeah. If you're noticing that pattern is happening as you're stepping into patient rooms, as you're trying to deal with, the normal issues and questions that come up in clinical care, I try and pay attention to that. And my husband has an expression that he often uses with me, like if he sees that I'm extremely tired and really burned out. He's like, it's an 8:00 night, right? Like you got to go to bed at 8:00 tonight, and you just need a good night's sleep, right?
I love it.
And so listening to those people around you is actually really important as well. I find when I'm getting short with my son at home, or I just have extremely little patience with the things that I can typically brush off, that's when I will try and slow it down. And so for me, that really means limiting the work that's interfering often with my life outside. Right. So the things I try and do are trying to move any after hour meetings sort of back into the day hours, saying no to more things. Sure. And then, trying to find those ways that allow you to just feel in more control, So for me, a lot of that is kind of taking inventory and just understanding what I need to get done in which period of time and trying to find a light at the end of that tunnel, right? Because your really high, busy and stress periods, hopefully, are not often more than, a few weeks at a time. And so trying to really understand, okay, after this period, I'm going to really focus on that diastole, like being able to fill your cup and kind of just being able to integrate more of that balance. Yeah. And so every day is not a balance, right? But over the course of months, you really do hope that you can create more time for that.
Yeah, you talk a lot about control, which I think is important. And we know that from, job satisfaction outside medicine, that's important. And it is true that most of our jobs are a combination of things that we can control and things that we can't control. And probably that those periods that you're feeling on edge are the time to, really take control of the things that you can control, maybe leaving space for the things that you can't. I really like that as a recommendation. Do you think, I'm sure you're going to say yes to this, but I kind of have to ask. I mean, when I think back on my career, and I often tell the residents, when I'm, telling Days of the Giants story about, the absolute low point of my life in September of my internship. And as I think back on that, there's no question, I had burnout, but at the time, there was no word for it. There was nobody to talk to. It was I think the response was, internship sucks, and you'll get through it. I assume that with the work you've done and with the effort you've done, that you sort of feel like this attention to it and this acknowledgement actually helps individuals.
I really think it does, because we've named it, right? We've defined what the problem is. I remember, I think the lowest point of my burnout was probably when I was a resident as well, my second or third year. Yeah. There was no way to describe it, right? I just was deeply unhappy, and I was probably clinically depressed at the time as well, right? And just trying to power through and kind of finish. Yeah. And I think that I didn't feel safe. I didn't feel comfortable talking to my program director about it. Yeah. I didn't really even understand, more the cycles or just the experience of it, right? And I think now there is open discussion about burnout. Absolutely. And I actually think that, it is a spectrum we talked about earlier. There's stress, there's burnout, but then there's also more concerning mental health issues that come up. Right. For physicians, I think oftentimes burnout is a safe way to talk about mental health, right?
That's
it's a
great.
safe way to really just say, listen, I am struggling and I just need a little bit of help, or I need to take a little distance and be able to step back in when I need to. I need to lean out at this point. I think it's helping us to create maybe more understanding of the impact that burnout has on our ability to care for patients, to be productive in our academic lives, to do the work that's meaningful for us, for our patients, for our students. And I think having these structures in place, a wellness director at the medical school, the DIO who has to think about well-being as part of accreditation, and then the alphabet of soup, the AMA, and National Academy of Medicine, like every single organization that pertains to education, they're paying attention and they're making calls. But I do think the problem is we have defined the problem excessively. There's so many studies out there about the prevalence of burnout, the prevalence of depression, mental health, those types of issues. And while there are some early studies that are taking a look at what interventions are effective, that's still really quite young as far as understanding, okay, what are the things that we can do as a profession to really address this workforce issue that we have. Yeah. And so I do think that the next steps in being able to really tackle this are really going to be around more studies that are, really well done around organizational interventions with the EHR, with, team-based care, with documentation, with really thinking about the culture and leadership around medicine. That there's, a push towards having, chief wellness officers. Does that work? And that's a phenomenon.
You're put yourself out of a job.
Yeah, right. I mean, that just started in 2015 when Tate Shannenfeld stepped into his role at Stanford, and obviously, in the interim, the pandemic has been happening.
Right.
And so that's challenging. But, does having that high level of accountability and someone whose job it is to wake up in the morning and think about burnout in the physician and clinical workforce, like what are those things that we can do to really address it at that level so we can help the individuals who are here?
That's great. Thank you very much, Wei. This was really a wonderful conversation.
Thank you, Adam.
We're sponsored by the Bucksbaum Institute for Clinical Excellence at the University of Chicago. Please feel free to reach out to us with your thoughts and ideas on the Bucksbaum Institute Twitter page. The music for the Clinical Excellence podcast is courtesy of Dr. Malin Martinez.